So Nick, are you going to pick up on the aims?
Yes, I can do that. So in terms of the aims of why we're here today, and I kind of alluded to this in the agenda. So I'll be sharing the results from our survey of current practice, which Ro just referred to as part of Stream 1, about how outcome measures are being used with children and young people with learning disabilities, their families, their carers, and their networks. And then we'll pause and have a little moment to think. And then we'll also be sharing a framework to support young people to hear the voice of children and young people, especially those with severe or multiple and profound learning disabilities. And there's some good practice initiatives and resources there. So we'll be summarising what's come out of the project so far, but also our aim is to give you the opportunity to share and reflect on your own practice, both in larger group discussion and also in the smaller group discussions too, thinking about what works well. Okay, so into the first part of our findings, and I'm going to talk to you now about using outcome measures with children and young people with learning disabilities. And I'm going to share some of the project findings with you and then move on to some implications for practice. And before I actually start, I'm going to give a bit of a health warning, I suppose. When we're talking about outcome measurement, we're talking about those kind of questionnaires and surveys that users fill in, that parents might fill in, and that practitioners might fill in. The world of outcome measurement is full of acronyms, and I will be using some of those acronyms as we go, particularly when we're talking about the different measures that are being used. Don't worry if they're not that familiar to you. On our Cork website, you can find out more about all of these measurement tools. So do use the slides afterwards to follow those up. What I didn't want to do was show you a whole set of questions and questionnaires that wouldn't be that easy to take in. So we made the decision to use those acronyms and abbreviations as we go, but there is an encouragement there to follow it up afterwards. Yeah. So
Nick, I think on a couple of the slides there is a key. It's going to be too small to read it probably, but when you get the slides you'll be able to make those bigger as well.
There will. So there will be a key, and they are searchable on our website. Thanks for that reminder, Ro. Okay, so in terms of this part of the work, what did we do? And what we wanted to do was really find out what current practice was like. So in the first instance, we shared a survey with practitioners all across the country, and we gathered all sorts of information from them, which I'm going to share part of that with you. What we also did was we at Cork hold a large data set of outcome measures from a huge range of different services. So we also analysed the data that we had for this particular group of young people to see what that said. So I'll be sharing some of that with you. From that quantitative data, we broadened out into some qualitative survey, so gathering all sorts of varied feedback from practitioners. And then Ro and Jenny and others within the team led workshops with practitioners to get even more qualitative data. And then we collated all of that together, and I'll be sharing some summaries of that with you. And then from all of that, we analysed the quantitative, and it should say, and qualitative findings. We've pulled all of that together and then pulled out some implications for practice that we'll also be sharing with you now. So they were the kind of 3 steps. And as I talk through, you'll see how those things move forward. So we did send out this survey. I'm not going to take you through the detail of the slide. This is there for you to have a look at. But the main things to draw out from this were, in terms of the key elements, is obviously we wanted to know who was answering the survey, but we wanted to know, okay, what outcome measures, what questionnaires, what tools are you using routinely, so that we could get an idea of the kind of range across the country. And then we asked follow-up questions about each of the ones that were being used to say, really, who do you use it with, which groups of young people, what types and levels of learning disability, what age groups do you use it with. And then we asked the practitioners to make a judgment really as to how useful they found it for them as a practitioner, and how useful in terms of detecting change for that young person, but also how easy it was for the parent or the carer of the young people to complete that too. So they were the main things that we asked about, kind of pulling that together into sort of pros and cons of each measure. We also, which I'm not going to go into a huge amount of detail here, asked questions about what happened to that data afterwards, and how they gave feedback to parents, carers, and children and young people. So that was the survey, and these were the results. So already I've gone acronym mad on here. So you can see, and as Rose said, along the bottom of the screen, you can see what all of these acronyms are. But what we've got here is really the main outcome measures, the main tools that the people who responded to our survey were using. So first of all, we asked whether people were using it, and we can see that the goal-based outcome measure, which we did have Duncan Law in our team, he was pleased to see that the goal-based outcome measure was being used really, really often. And when we looked at the feedback, what we heard from practitioners was that's because we're talking about a very varied group of young people with really, really different needs, and being able to set those individual goals was a really important part of their support. So not only did we see they were using that a lot, actually that was the one that came out top in terms of being useful. We also, and you can see, I'm not going to talk through all of these on the list, some of the other ones, the SDQ was being used often. You can see from the left-hand graph, both the SDQ parent and the SDQ young person. But then when we look at the graph at the right-hand side, when we asked practitioners how useful they were, that came lower down the list. So what we started to see was where there was a match between what was being used often, but also what the utility was. And we know from talking to practitioners that sometimes there was an expectation to use measures that perhaps the practitioners didn't feel that was that useful, but it was a requirement of their service. So they were continuing to do that. What we did see in terms of the measures being used is some of the more specialist measures, the Sheffield SL-DOM, third one down, being used pretty frequently. The Nisonga on the right-hand side, not used as frequently, but those people who do use it frequently find it a really, really useful tool to use. So you can see how what people do use and how useful they find it don't necessarily line up, but we could already start to see that there were some patterns here. Interesting to see the TriSQ, so an experience of service measure, asking people how they found the support they'd received, was used pretty frequently, but people really valued the information that gave. So this was the start of our information, and that was from 95 practitioners that responded to our survey. What we then did is pull out of the survey actually to understand a bit more about who these particular tools were being used with. So you can see that the green is where people found it useful for that particular group. So that was where the majority of people who used it felt, actually, I find that the goal-based outcome measure, the top one, is useful with children with mild learning disabilities right through to profound learning disabilities. But we also could see that for some particular groups of young people, that actually practitioners didn't find it useful at all. And that's where you can see the red on the chart. So you can see that there are some patterns starting to emerge. We also asked about age group. Now, we know that for some of the services, they weren't perhaps working with children and young people over 18. So that might slightly skew that data for the older children and young people, but we do know that there were that people did express a kind of concern that they didn't have much that they could use with younger children. But you can see from that table which age groups practitioners felt these were useful for. So from the survey, we were already starting to build a picture both of what was happening, but also what those experts, those people who are front-facing on the ground, working in services, find is actually useful to their work. Which, you know, what we want is to be doing things that are going to make a difference to children and young people. Okay, so then, as I said, we looked at the information that was held in our core data set. We did quite a detailed analysis, pulling out all of the cases that were from that we identified as being children or young people with a learning disability. That may be children and young people accessing a specialist service, or it may be children or young people that have been identified as having a learning disability that are accessing a mainstream service. But in the main, these are people who are accessing either NHS or voluntary sector services. And then we could see and you can see from the chart on the right-hand side, when these tools were being used. And we could see that the parent SDQ was mainly used just at first time point at the start of service, but was used at first and last by a small group of people. But I think the interesting thing for me that comes out there is actually that goal-based outcome tool that came top of the lists in the survey is the one that's most frequently used at both of those time points. So we can see that's a popular tool that seemed to be useful that people do the follow-up with. Okay. And then we asked a broad range of qualitative questions. And this is really a summary of what practitioners have to say. And the responses very much fell into groups. So we grouped those responses. That there were the tools that were felt to be appropriate. There were those that were sometimes appropriate, some reservations there, but might be appropriate some of the time. There were some that people identified as being appropriate with the most able children and young people. So not for everyone, but for some young people, perhaps with milder learning disabilities, that they were useful. And then there were some which, if you are memorizing the charts from the earlier slides, you'll know featured as being used quite frequently, that actually people like these really aren't appropriate and we shouldn't be using them with these groups of young people. So we grouped those responses, and as you'll be able to see as we're working through, we can see some of the tools are coming up more often on both the frequency and the utility. And through this work, we were starting to build a pattern of actually, this is what seems to be working. This is what practitioners think works, and this is what we wanted to share. So we pulled all of this information together onto a chart that I more expect you to use for reference than to inwardly digest at this particular point. But you can see here the main measures that were being used, and pulling together all of that information from previously and putting that onto a matrix with a little bit more detail about how parents and carers view the measures and how the practitioners view the measures, so you can see where that differs. And from that, and I think this is a useful tool for anybody who is working in whatever kind of service. Actually, if you're working with somebody with a mild learning disability, something like the SLDOM seems like a useful thing to use. But actually, some of the other tools that are shown further down might feel less appropriate, and you can see that. So from that, our aim was to pull out some suggestions of recommendations, and I'm going to move on to the next slide. But in summary, the ones that I've highlighted in green across the top are the ones that actually seem to be the most useful, seem to be felt by practitioners to be useful, and parents and carers find them relatively easy to access. The ones that I've shaded in a light orange, perhaps useful some of the time, and then the ones at the bottom were the ones that really didn't feel like they had a huge amount of utility for this particular group. And so we pulled that together into some recommendations, and when we report from the project, these are the recommendations that will be going forward. And so we identified a core set of tools that we felt were suitable for most of the young people within this group. What we were keen is that there was a balance between the kind of standardized measures like the SLDOM and the Nisonga measure, but also an experience measure in there, the CHI-SQ as the experience measure, and the goal-based outcome as an idiographic measure, which is based on actually this is what's important for this young person and their family and their network. So having that balance across that, so having that core set, and then we identified some additional measures, which you can see lower down the slide, that might be suitable sometimes, and that could be used in addition to that core set.